up guys, my name is Kiara Selena and welcome back to my channel, and today's video is going to be about whether or not you should go to RPN school or RN school first. So I'm going to give you guys my personal opinion and hopefully that'll help you make your final decision. So if you're interested in seeing this video, stay tuned. So if you're a registered practical nurse or a licensed practical nurse, you are a step underneath a registered nurse. Now there are different levels of nurses, different types of nurses. You have registered practical nurses, you have registered nurses that are ADN, and then you have registered nurses that are BSCN, Bachelor's in Science in Nursing, and then you have advanced practitioner nurses like nurse practitioners and nurse anesthesists. So there are different types of nurses and different levels of nurses, but we're strictly going to focus on RNs and RPNs because that's pretty much my area and what I know about. I mean, I know about the other things too, but I don't feel like I'm well informed enough to really give you guys details about that. So let's just focus on ADN-RN or BSCN-RN and RPN. Now, as an RPN, you're going to complete tasks that are very, very similar to RN. As for me, and based on my personal experience, when I go on my clinical rotations, or for everybody else that I know who's in nursing school, whether they're in RN school or in RPN school, a lot of the times you'll have RNs and RNs paired together, or an RPN and RN together paired together for the duration of the shift. So as an RPN, you aid in assessment, you help in the care plan, you draw blood, you can give IV fluids, and this is where the main difference between RPNs and RN comes in. If you are an RPN, you can give IV fluids, so you can give NS intravenously. You can put the needle in, start the IV, hang the bag and everything. However, when it comes to medications, you cannot give medications intravenously. You can give every other type of medication. So we give subcutaneous injections, we give intramuscular injections, Ventolin, oxygen, what else? You draw blood, and IV fluids, but no medications. I know that depending on where you live, I think in certain places in the States, you can give certain medications if you have training for it. I think that may apply in some places in Canada as well. I'm not too sure, but that's really the main difference between the RPN and the RN, the intravenous medication. Instead of reporting directly to the doctor, you will go to the RN first. The RN will confirm whether or not she agrees with the fact that it's a decubitus ulcer, and you guys can continue on from there. If the RN is not sure of what it is, then you or the RN will go and report to the doctor, and then the doctor will come and make a diagnosis. That's pretty much it. So a lot of your reports, if you're unsure of something, you will report to the RN before reporting to the doctor, since they're a step above you, I guess. Now, for the big question, which is whether or not you should go to RPN school or RN first, or RN school first. Like I said, it really depends on your situation. What is your situation? Do you have love for nursing, but you really just want to be, in and out as fast as possible? If that's you, then maybe RPN school is a little bit better for you. You really want to get into the field and you want to make some good money, but you don't want to be in school for too long, then RPN school would be the best thing for you. Go to RPN school.